Risk factor absolute risk. Age and sex. Premenopausal women have lower rates of disease than men, although this sex difference disappears after the menopause. Positive family history runs in families due to combination of shared genetic, environmental, and lifestyle factors. Risk factor relative risk. Smoking, strong consistent dose linked relationship between cigarette smoking and IHD, especially in younger, more than 70 years individuals. Hypertension directly proportional, hypercholesteremia directly proportional to serum cholesterol concentrations, diabetes mellitus, potent risk factor for all forms of atherosclerosis. Man with type 2 diabetes 2 to 4 fold greater annual risk of CAD. A woman with type 2 diabetes 3 to 5 fold risk. Now, homeostatic factors, platelet activations, antiphospholipid antibodies, physical activity. Physical inactivity roughly doubles the risk of coronary disease. Regular exercises increased serum HDL cholesterol concentrations, lower BP, collateral vessel development, obesity, often associated with HTN and cardiovascular disease. Alcohol excess consumptions, other dietary factors like fruit, vegetables, polyunsaturated fatty acids. Personality, little or no evidence to support the popular belief that stress is a major cause of CAD. Social deprivation. Primary prevention. Primary prevention strategies taken before onset of disease. High risk individuals to complementary strategies. Population strategies modify the risk factor of the population through diet and lifestyle advice. For public restricting of smoking, targeted strategies identify and treat high risk individuals who usually have a combination of risk factors can be identified by using composite score. Angina. Angina is a pain which occurs in these areas of the body when your heart muscles does not get enough oxygen rich. A types of chest pain, not a disease, it's a symptom of an underlying heart problem, especially IHD, described as a heavy, tight, or gripping, typically central retrosternal mild A to most severe that provides sweating and associated breathlessness. Classification. Class 1 no angina, Class 2 angina during ordinary activity, Class 3 angina critical level of activity. Example walking 50 to 100 yards on the flat, walking up on one flight. Class 4 angina at rest or with any level of exercise. At classical or exertional angina factors characterized by constricting discomfort in the front of the chest, arms, neck, jaw, provoked by physical exertions, especially after meals, and called windy weather or by excitement and relieved, usually combined with rest or glycerol trinitrate occasionally. It disappears with continued exertion, walking through the pain. Typical angina, all three features. Typical angina, 2 out of 3. Non-anginal chest pain, one or less of these features.